Hello medico people. So today we are going to learn about human echinococcus. So what is human echinococcus? Firstly, it is a zoonotic disease. What is zoonotic disease? The disease that can be transmitted between animals and the humans. Okay, and this zoonotic disease is caused by a cestode of genus Echinococcus. Okay, it generally occurs in four forms. What are that? Cystic echinococcus, alveolar echinococcus, and two forms of neotropic echinococcus. Okay, so the cystic echinococcus is caused by Echinococcus granulosus, and this is also called as Hydatid disease. The cystic echinococcus is also called as Hydatid disease. And the alveolar echinococcus is caused by E. multicularis. And there are two forms of neotropic echinococcus, that is polycystic hydatid disease and unicystic hydatid disease. Okay, in polycystic hydatid disease, this is caused by Echinococcus vogeli, and unicystic hydatid disease is called by Echinococcus oligarthus. Okay, so in this video we are going to learn about the cystic echinococcus, which is also called as hydatid disease. Okay, so the cystic echinococcus is caused by Echinococcus granulosus, which is also called as the dog tapeworm. Okay, what it is called? It is called the dog tapeworm. So coming to the morphology of the Echinococcus, generally it is a tissue cestode. What is it? It is a tissue cestode. So it has three morphological forms. What are those? Adult form, larval form, and egg form. Okay, the adult form generally resides in the dog's intestine. Okay, and it is 3 to 6 millimeter long and has three parts. What are those three parts? Head, neck, and strobila. And these can be also be as three proglottids even. Okay, that is about the adult. And next, coming to the larval form, the larval form of the Echinococcus is the Hydatid cyst. This is the very important point. Okay, the larval form of the Echinococcus is the Hydatid cyst, which is the pathogenic form. Okay, and it causes cystic lesions in liver and other organs. Okay, next, coming to the egg form, the embryo has 6 hooklets surrounded by an embryophore, and the main important thing of egg form is that it is the infective form. Okay, so here you have to stress on 2 points, that is the larval form is the pathogenic form. Okay, and the egg form is the infective form. So here, what is the difference between the pathogenic form and infective form? Okay, the pathogenic form causes disease. Okay, it is the disease causing stage. But infective form is, it only infects the host. It may cause disease or may not cause the disease. Okay. Next, we are going to talk about the life cycle. When we talk about the life cycle, first we will talk about the hosts. So there are how many types of hosts? Two types of hosts, that is definitive host and intermediate host. So what is the definitive host in this? Dogs and other canine animals. That's why we call the Echinococcus as dog tapeworm, right? The next intermediate host is the sheep or other herbivores or man. So here the important thing you all have to remember is man is the accidental host. Why it is called as accidental host? Because when the eggs of the Echinococcus get enter into the man, it will be the dead end for the Echinococcus life cycle. So this leads to the dead end of the life cycle. So that's why man is called the accidental host. Okay, and next, coming to the infective form. I already told you previously that infective form is the eggs, right? And next, coming to the mode of transmission. So how it is getting transmitted? It is in man or any other intermediate host. This gets transmitted by ingestion of food contaminated with dog feces containing E. granulosus eggs. Okay, So this is the life cycle of the Echinococcus. Okay, when the intermediate host acquires infection by ingestion of food contaminated with dog feces containing eggs, it reaches the duodenum and penetrates into the intestine and gets the hexacanth embryo. I told in the morphology, right, that the eggs has the hexacanth embryo. That is, the 6 hooklets are present. That gets hatches out and penetrates into the intestine. And through circulation, it gets developed into a fluid-filled bladder-like cyst. What is that? Fluid-filled bladder-like cyst. That is called the hydatid cyst. Okay, so this gets developed into the hydatid cyst, and after that, in the intermediate host, this is the dead end. Okay, this is the dead end in man. Why? Because the dogs will not feed on the human feces or the human viscera, right? So there will be no infection again to the definitive host. So here the cycle will be stopped. But in case of if the sheep is the intermediate host, then the dogs might feed on the sheep meat consisting the hydatid cyst. Okay, so this leads to the ingested scolex, which enters into the intestine and gets evaginated, and there it grows into the adult worm in the small intestine of the dog, and again the eggs will be released in the feces. Again the cycle will be starting again by ingestion of the food contaminated with dog feces. Okay, so this is the life cycle of the Echinococcus. This is the life cycle of the Echinococcus. So next we'll see about the pathogenicity. So previously I told you that the larval form is the pathogenic form, right? So this leads to the pathogenicity. Okay, now coming to the hydatid cyst. In the hydatid cyst, so generally it is of 4 parts, but before that we'll describe the hydatid cyst. Okay, so how is the hydatid cyst? Firstly, I told you that it is a fluid filled bladder like cyst, right? So what is it? It is a fluid filled bladder like cyst. Bladder like cyst. And nextly, it is unilocular, okay, and is subspherical in shape, and it measures 5 to 8 centimeters. Okay, that is the average size of the hydatid cyst. Next, coming to the parts of the hydatid cyst. So there are 4 parts. What are those? Cyst wall, brood capsule, hydatid fluid, and hydatid sand. And again the cyst wall is of three parts, that is outer pericyst, middle ectocyst, and inner endocyst. In this, the outer pericyst is the host derived, that is it is derived from the host. Okay, and next coming to the brood capsule. So how is the brood capsule formed? The inner side of the endocyst, that will give rise to your brood capsule. And what is the main function of the brood capsule? It secretes the hydatid fluid, and it also contains a number of protoscolysis. Okay, next coming to the hydatid fluid. So now here we'll describe the nature of the hydatid fluid first, and next we will talk about the functions of the hydatid fluid. Okay, so how is the hydatid fluid? It is clear, pale, and yellow. Okay, and how is the fluid now? That is, it is antigenic, toxic, and anaphylactic. Okay, so 2 A's and 1 T. Antigenic, toxic, and anaphylactic. Okay, next about the hydatid sand. So how is hydatid sand formed? It is the deposition of brood capsules and the protoscolysis. Okay, this is about the hydatid cyst. Coming to the fate of the hydatid cyst. So the hydatid cyst may undergo spontaneous resolution or rupture of the cyst. Okay, so the rupture of the cyst may be like a formation of secondary cysts, or maybe anaphylactic reaction to the hydatid fluid antigens. Okay, and next coming to the clinical features of the hydatid disease. The most common site infected is the liver, that is the 60 to 70% the liver is infected, and that too the right lobe is infected. After that, lung is infected, maybe a 20% of cases, and next kidney, muscles, spleen, soft tissues, brain and other may be infected. And in asymptomatic people, the cyst grows 5 to 10 centimeters in the first year. Okay, and after that, even in decades, in coming decades also, the patient may be asymptomatic, that is there will be no symptoms seen. And what if there are symptoms? So there are four types of symptoms which we can see, that is pressure effect of enlarged cyst, obstruction, secondary bacterial infection and anaphylactic reactions. Okay, in pressure effect of enlarged cyst, the effects may be of hepatomegaly, portal hypertension, palpable abdominal mass, and ascites. And coming to the obstruction of the biliary tract may cause cholestasis, cholangitis, and dyspnea. And the secondary bacterial infection may be causing the pyogenic abscess in the liver. So, what is pyogenic abscess? So, pyogenic abscess means it is the pus-filled pocket of fluid in the liver. Okay, and anaphylactic reactions include cystic leakage. That cystic leakage may lead to hypotension, syncope, and fever. That is about the symptoms. And what if it is in younger children? In younger children, it leads to extrahepatic cysts in lungs, brain, and orbital sites. And sometimes this disease may also cause allergy. So that allergy may lead to atopy and anaphylaxis. So now we are going to learn about the laboratory diagnosis. Okay, so there are how many methods of laboratory diagnosis? There are 6 methods of laboratory diagnosis, that is Hydatid fluid microscopy, molecular methods, antibody detection, histological examination, skin test and some imaging methods. Okay, now first coming to the Hydatid fluid microscopy. So how it is done? It is generally done by direct mount or by acid fast staining. Okay, so why it is done? It is helpful in detection of brood capsule and protoscolysis. Okay, and next coming to the molecular methods, it is by PCR or by PCR RLFP, and generally and also molecular typing also. Okay, and in generally there are 10 genotypes. How many genotypes? 10 genotypes. In that, in India, the type 1 genotype is more common. Okay, the type 1 genotype is more common. Okay, and next coming to the antibody detection. So antibody detection is done by ELISA, Digfa and Western blot. And the Western blot is the specific serological method. Okay, you have to remember this. What is Western blot? It is the specific serological method. And how is ELISA done? ELISA is done by using B2T antigen. Okay, how is ELISA done? It is used by using B2T antigen. And next coming to the histological examination. So what does this demonstrate? It demonstrates the cyst wall attached to the brood capsules. Okay, and next coming to the imaging methods. So there are some imaging methods like MRI, X-ray, USG, that is ultrasound sonography, and CT scan. Okay, so what is the main thing you have to remember here is in USG you will get to see the water lily sign. What you will see? The water lily sign. This is the very important thing you have to learn over here. Okay, so the USG demonstrates the water lily sign. Okay, and next coming to the skin test. So skin test is the test performed here is called the Cassoni test. Okay, generally it is an immediate hypersensitivity reaction. Okay, that develops following injection of hydatid fluid antigen. It is developed by Cassoni. Okay, so that's why this test is named Cassoni test, but now it is obsolete. Okay, so this is about the laboratory diagnosis. And next coming to the treatment. So the therapy for cystic echinococcus is mainly based on viability, size, and location of the cyst. Okay. So there are 4 methods of treatment. So first is the pair, surgery, antiparasitic agents, and percutaneous thermal ablation. So what is pair? So it is an alternative method recommended instead of surgery. Okay. And in this, P means puncture, A means aspiration, I means injection, and R means reaspiration. Okay. So that is percutaneous puncture of the cyst, aspiration of 10 to 15 ml of cyst fluid. Okay. And infusion of colicidal agents like hypertonic saline. What you're giving? Hypertonic saline, cetrimide or ethanol, and again reaspiration of fluid after 5 minutes. So that is the paid method. Okay. And next, surgery can be done, or antiparasitic agents can be also given like albendazole. Okay. But in case of pulmonary cysts, okay, in case of pulmonary cysts, albendazole is not given. Okay. The preoperative albendazole is not given. Instead, we will give praziquantel. Okay. And next, percutaneous thermal ablation. Okay. In percutaneous thermal ablation, what is it? It is a non-invasive method, involves percutaneous radiofrequency ablation of the germinal layer of the cyst. Okay. So this is about the cystic echinococcus or the hydatid disease. Thank you for watching.